Welcome to another session of Understanding Human Anatomy. We'll continue our discussion of the thorax, and in particular the respiratory system, by discussing the structure of the lungs in this video. In this slide, we're going to draw the left and the right lung. I'm going to start with the right lung. And the lung is pyramidal in shape. So let me draw it in like so. So this is the right lung. And like all pyramids, it has a pointy top, the apex, and it has a broad bottom, which is called the base. And the base of each lung sits on the diaphragm. Remember, we drew the diaphragm in a previous slide. Now, the right lung has 3 lobes, and the lobes are defined by fissures. We have a fissure that we can just see part of in an anterior view like this, running like so. And this is the oblique fissure. And it's named oblique because it's neither running directly superior or posteriorly, nor directly medial laterally. It's running at an angle to those two standard directions. So the oblique fissure here. Then we have another fissure that's running horizontally like so. This is the horizontal fissure. And you can see that we've divided the lung into 3 parts, 3 lobes. We have a superior lobe, We have a middle lobe, and we have an inferior lobe. And there's not room to put the label within the lobe, so I wrote it to the side, and I'll draw a line in to the lobe. So 3 lobes of the right lung. Next, we'll look at the left lung. And again, the lung is in the shape of a pyramid. But we find that there is a notch in the left lung. And in the left lung, we only have one fissure. We only have 2 lobes, so we only need one fissure to separate out the 2 lobes. And that is an oblique fissure on the left side. So let's put some labels in. And we have an oblique fissure, draw a line to it. We have the superior lobe of the left lung, and then we have the inferior lobe of the left lung. Like so. What we're going to find is that the space that we have the notch here is going to be filled with the heart and pericardium right in this area. So this notch is called the cardiac notch. And of course, that cardiac refers to the heart. And this tissue on the inferior side of the cardiac notch resembles a tongue. And so Latin for tongue is lingua. So this is the lingula. or tongue-like appendage of the left lung. We only have the cardiac notch and the lingula on the left side. Now, let's look at these two lungs from the posterior lateral aspect. Now, in the posterior lateral view, the relative positions of the two lungs are reversed. So that the left lung is over here on the left side of the slide. And let me sketch it in like so. And just so I know it gets confusing when we change our views, this is the left lung. And again, I'm going to draw in the oblique fissure. So that and a line going to it. And the oblique fissure divides the left lung into a superior lobe and an inferior lobe. Again, we have a cardiac notch visible. And the lingula. Moving over to the right lung. I'll draw it in like so. So that again, so no one gets confused. We have the right lung. And the right lung will have two fissures, an oblique fissure, like so, and a horizontal fissure. So let me put the labels in here. Get the line going over to it, and then the horizontal fissure, line to it, and then these two fissures divide the lung into three lobes: a superior lobe, an inferior lobe, and a middle lobe. Thus, the right lung with three lobes and the left lung with two lobes. That concludes our discussion of the bronchial tree and the lungs. In the next video, I will discuss the mechanism of respiration, the mechanism of breathing, how we get air into and out of our lungs. Thank you for your attention.